This episode is adapted from a clinician-written article on Mentalyc and brought to life in audio for therapists who prefer listening on the go.
Yeah, and this piece was written by Adesola Olajire, LCP, and we're really glad to be sharing their perspective with you today.
And if you're new to Mentalyc, it's basically a platform that helps therapists with documentation and treatment planning, so you can spend more time in the actual work and less time in the notes.
All right, so let's drop into real life for a second. You know that client who looks competent on the outside, maybe high-achieving, but every time you name a success, they kind of shrug and say, yeah, but anyone could have done that.
Yes. Or the client who avoids every new opportunity, every promotion, every relationship risk, because deep down, they're convinced they'll fail or be exposed as not enough.
Exactly. And we're sitting there as clinicians thinking, this isn't just about mood. This is about self-esteem as a whole structure. Not just how they feel today, but how they see themselves, how they value themselves, and whether they trust themselves to cope.
Yeah. One thing that really stands out for me in this conversation is that building client self-esteem is not just, holding space while they vent about how bad they feel. It's actually a pretty active process on our side. We're not just witnesses, we're collaborators in rebuilding a sense of self-worth.
Right. And I love framing self-esteem as sitting on those three pillars: self-image, self-worth, and self-confidence. How I see myself, how I value myself, and whether I believe I can actually do things in the world.
Yeah, because clinically, you'll see them show up differently. Self-image is that I'm broken, I'm ugly, I'm weird narrative. Self-worth is I don't deserve good things. And self-confidence is even if I try, I'll mess it up.
And when those three line up in a negative way, we get clients who avoid challenges, stay small, but still live in constant fear of other people's judgment. It's such a painful bind. I won't try, but I'll still feel like everyone's watching me fail.
On the flip side, when there's a healthier sense of self-worth, challenges start to look less like threats and more like, okay, this is going to be hard, but maybe I can grow from it. Not confidence as in arrogance, but confidence as in, I can survive trying.
Yeah, and I think the big insight for today is this. Self-esteem grows most reliably through lived experiences of competence and compassion, not just insight. So we're helping clients do things differently and also talk to themselves differently over and over.
Exactly. And that's where really concrete work like strengths-based interventions, SMART goals, CBT restructuring, and even environmental changes in therapy come in. It's not glamorous, but it's incredibly powerful.
So maybe let's walk through some of the pieces we actually use in session, because I know people listening are like, okay, but what do I do with my 3 p.m. Tuesday?
Yeah. Let's start with self-compassion and strengths, because that's often where I begin when self-esteem is really low.
Same. When a client's self-talk is brutal, I'll usually normalize that first. Like, you learn to speak to yourself this way for a reason. It probably protected you at some point, and now we get to see if it still fits.
And then shifting toward strengths. I don't just ask, what are your strengths? Because most low self-esteem clients will say, none.
Oh yeah, that question bombs so fast.
So I get more concrete. Tell me about 3 things you've done recently that were even slightly hard. It could be, I got out of bed on a bad day. I sent that awkward email. I showed up to therapy. Then we unpack, what did that take from you? What qualities did you use?
Exactly. And we start naming persistence, courage, emotional awareness, responsibility, creativity. I'll say, if I were a neutral observer, what strengths would I see in you from that moment?
And then I like to help them map those strengths onto different domains of their life. Okay, that persistence you use at work, how might that show up in your relationships or in self-care? So it's not just a one-off, it becomes part of a broader self-image.
Yeah, and I often ask them to start a strengths and wins log in a journal. Not in a toxic positivity way, but in a gentle, realistic way. Today I did this. The strength behind it was this. It's like building a new internal evidence base.
And we pair that with reframing mistakes. Instead of, I failed, therefore I'm worthless, we move toward, I made a mistake, which means I'm human, and there's something I can learn here. It sounds simple, but for a lot of clients, it's a completely new way of existing.
All right, quick pause here. If you're hearing this and thinking, I love doing this work, but documenting it clearly for insurance or for my own tracking is exhausting, Mentalyc can actually help. Its AI treatment planner lets you set smart goals, plan interventions, and track progress in a way that mirrors what you're already doing clinically while staying HIPAA and SOC2 compliant. You can check it out at Mentalyc.com.
Okay, so let's go deeper into goal setting, because that's another huge lever for self-esteem.
Yeah, a lot of clients come in with either no goals or these massive, vague ones like, I just want to love myself, or I want to stop caring what people think.
Right, and if we leave it there, they're almost guaranteed to feel like they're failing therapy, which ironically reinforces low self-worth. So I'll gently translate those into SMART goals: specific, measurable, achievable, relevant, time-bound.
For example, instead of love myself, we might say, for the next 2 weeks, I'll practice one self-compassionate statement per day when I notice self-criticism. Or I'll attend one social event this month and stay for at least 30 minutes.
Exactly. And I'll name why we're going small. Every time you follow through on a small, realistic goal, you're proving to yourself that you can trust yourself. We're building personal trust, one brick at a time.
I love that phrase, personal trust, because that's really what confidence is. When I say I'll do something, I'm reasonably likely to show up for myself.
And then we track it. Some clients like charts, some like phone notes, some like photos. I've had clients take a picture every time they go for a walk or clean a small area of their home. It becomes visual proof. I'm not as stuck as my brain tells me I am.
And in session, I'll ask them to bring a weekly log of accomplishments, no matter how tiny. I answered a text I'd been avoiding. I cooked one meal. I didn't check my ex's social media. We celebrate those like they matter, because they do.
And from a documentation standpoint, that's where having a structured treatment plan really helps. If we've named goals and expected outcomes, it becomes much easier to show progress over time, both to ourselves and to payers.
Yeah, and that's where I found Mentalyc's AI treatment planner genuinely useful. I can set goals like client will identify 3 strengths weekly, or client will challenge 1 automatic negative thought per day, and then update progress as we go. It mirrors the real clinical work instead of forcing me into a totally different structure.
Let's talk about 2 areas that often get folded into self-esteem work but don't always get named clearly: social connectedness and productivity.
Yes, when clients feel unworthy, they either overperform socially, people-pleasing, overfunctioning, or they withdraw completely. And both patterns reinforce, I'm not good enough.
So part of the work can be helping them gently improve their social life in ways that feel safe and aligned. That might look like initiate 1 low-stakes conversation per week, or respond to 1 supportive text instead of ghosting, or join a small group that matches your interests.
And we're not just sending them out there alone. We're preparing them. What thoughts might come up? What's your exit strategy if it's overwhelming? How will you debrief afterward? It's exposure, but it's relational exposure with support.
Same with productivity. Clients with low self-esteem often feel chronically behind, ashamed, and then paralyzed. So we might create micro goals around productivity. Work in 15-minute blocks, complete 1 small task before noon, end the day by acknowledging 3 things you did, not just what you didn't do.
And again, each follow-through becomes data. Maybe I'm not lazy. Maybe I'm overwhelmed and undersupported. Maybe I actually do have capacity when tasks are right-sized. That shift from global self-attack to situational understanding is huge.
Yeah, I like to normalize it as your brain running an old script. So we'll start with daily journaling, nothing fancy, just what happened, what did I think about myself, how did I feel, what did I do?
And we pay attention to patterns. Every time someone doesn't text back, I think I'm annoying. Or when I make a small mistake, my brain jumps to I ruin everything. That's where CBT really shines. Cognitive restructuring gives us a framework to work with that content. So, we'll have them write down the negative thought, then list evidence for and against it. For example, I ruin everything. Evidence for, I was late to 2 meetings. Evidence against, I've maintained my job for 3 years. My friends still talk to me. I've handled conflicts before.
And then we co-create a more balanced thought. Not, I'm amazing, if they don't believe it, but something like, I sometimes make mistakes, but I also handle a lot of things well. One late meeting doesn't define me.
We can also design behavioral experiments to test self-limiting beliefs. So if a client believes, if I say no, people will abandon me, we might plan a small no in a relatively safe relationship and then observe what actually happens.
The key, especially with low self-esteem, is pacing those experiments so they're challenging but not overwhelming. We want disconfirming evidence, not re-traumatization.
And this is where having a secure, emotionally safe therapy environment is not just nice, it's essential. If the client expects criticism everywhere, we can't replicate that dynamic in the room.
Yeah, so that means being intentional about things like privacy, interruptions, room setup, even lighting and temperature, but also the relational environment. Do they feel like they can bring their most shame-filled stories without being rushed or misinterpreted?
And of course, attunement to cultural background. A client's sense of self-worth is shaped by culture, family, systemic forces. We can't impose our own lens of healthy self-esteem without considering their context.
Exactly. For some clients, speaking highly of themselves might feel like arrogance or betrayal of their family norms. So we might frame it instead as accurate self-respect or honoring the effort you're putting in, which can land more safely.
And we model it. As therapists, we're not just teaching self-acceptance, we're demonstrating it. That might sound like, I missed something you said earlier, and I appreciate you repeating it. I'm not perfect, but I care about getting this right with you.
Yeah, that's such a powerful micro-repair. It shows boundaries, humility, and self-respect all at once. We're not beating ourselves up in front of them, and we're not pretending to be flawless. We're holding a realistic, compassionate stance toward ourselves, and they see that.
And we keep very clear therapeutic boundaries. That in itself is a self-esteem intervention. It teaches you are worthy of consistent, respectful treatment. You don't have to perform, and you don't have to chase me.
Let's touch on self-care and mindfulness too, because they're often dismissed as basic, but for low self-esteem clients, they're actually pretty radical.
Totally. Helping a client craft a self-care routine that matches their values, movement, sleep, time outside, creative expression, sends a quiet message. My body and mind are worth tending to.
And it doesn't have to be elaborate. A 10-minute walk, a consistent bedtime, journaling, sketching, listening to music mindfully. The content matters less than the underlying stance. I'm someone who deserves care.
Mindfulness practices help here too, teaching clients to notice thoughts as thoughts like, I'm having the thought that I'm a failure, creates a little bit of distance. Suddenly, the thought is not the truth, it's an event in the mind.
And adding gratitude or present moment awareness can gently shift the focus away from constant self-evaluation toward actual lived experience. The feel of the chair, the warmth of a mug, the sound of birds outside. It's small, but it can be very regulating.
We've talked a lot about CBT, but it's worth saying CBT is one powerful route, and there are others. Acceptance and commitment therapy, DBT, narrative therapy, psychodynamic work, they all have ways of touching self-esteem.
Yeah. ACT might focus on helping clients live aligned with their values, even when self-doubt is loud. DBT might help with emotion regulation and interpersonal effectiveness, which then feed into a more stable sense of self.
Narrative therapy invites clients to reauthor their stories. Psychodynamic approaches explore the roots of shame and internalized messages.
And of course, time matters. We can be transparent with clients that self-esteem doesn't usually shift in 2 sessions. CBT protocols might run 12 to 20 sessions, sometimes more, especially if there's co-occurring depression, anxiety, or trauma.
I like to frame it as, we're not just trying to feel better this week, we're trying to build a more solid relationship with yourself over time. That invites patience and also honors how much effort this work takes.
And occasionally, clients will ask, do I need medication to fix my self-esteem? And I'll clarify, medication can be really helpful for depression or anxiety, which often travel with low self-esteem. But medication doesn't directly install self-worth.
Yeah, it can reduce psychological distress enough that the therapeutic work becomes more accessible, but the actual rebuilding of self-esteem happens in the therapy relationship, in the client's environment, and in the choices they practice over time.
Which is why our documentation and reflection on that process actually matters, not just for compliance, but for us, so we can see the arc they went from avoiding all challenges to tolerating one hard conversation per week.
And I'll be honest, that's one of the reasons I appreciate tools that reduce the friction of documenting. When I'm less burned out by notes, I have more bandwidth to actually notice and celebrate those small wins in session.
Yeah. With Mentalyc, for example, I've used the AI treatment planner to quickly update goals as clients hit milestones or need adjustments. And the transfer your notes to EHR with a single click thing, no more copy pasting, sounds small, but it really changes how much energy I have at the end of the day.
And the nice piece is that the treatment plans can actually reflect your style, your interventions, your language, while still satisfying payer requirements and evolving alongside the client. That alignment really helps when you're doing nuanced self-esteem work.
All right, as we start to land this, maybe we each share one practical takeaway that someone could bring into their very next session with the client who struggles with self-esteem.
Yeah, I like that. Mine would be ask for 3 recent achievements and then co-name the strengths behind them. Don't stop at what did you do? Go to what qualities did that require and where else might those qualities show up? It's simple, but it starts rewriting the internal story.
I love that. Mine would be pick one tiny concrete goal that's slightly scary but doable and track it together. Something like send one honest text this week or practice one self-compassion statement per day. Then, next session, slow down and really savor the fact that they did it. That's how we grow personal trust.
And maybe zooming out, just remember, building self-esteem is slow, relational work. It asks a lot of our patience and our presence. We're not just treating symptoms. We're helping clients build a kinder, sturdier relationship with themselves.
If you'd like some support on the documentation side of that process, especially around goals, progress, and notes, Mentalyc's AI treatment planner and automated notes can really lighten the load. They're designed to help you capture the work you're already doing so you can stay more present with your clients and still meet all the clinical and administrative demands.
All right. Thanks for spending this time with us. Take what fits, leave what doesn't, and we'll be back with more clinician-to-clinician conversations soon.
Yeah. Take good care of yourselves out there, and we'll talk again next time.